Hello and welcome to Cancer Research Simplified. My name is Dr. Aigen Shahin and thank you for joining us today. Today we are going to talk about Hodgkin's lymphoma. Let's go ahead and start with what lymphoma is. Lymphoma is a type of blood cancer which occurs when one single cell of either B or T cell lymphocytes, which are both white blood cells that forms a part of our immune system, grow uncontrolled and eventually form a tumor. It can occur in lymph nodes, in spleen, in bone marrow, or other tissues. Let's talk about the types of lymphoma. There are two types of lymphomas, which is Hodgkin's lymphoma and non-Hodgkin's lymphoma. Hodgkin's lymphoma is abnormal, asymptomatic. Asymptomatic means with no symptoms. Malignant enlargement of lymph nodes, spleen, and liver. Histologically, the presence of Reed-Sternberg cells is an indication of Hodgkin's lymphoma. Non-Hodgkin's lymphoma, or NHL, is lymphoid cancer that is not Hodgkin's lymphoma. Let's talk about the details of Hodgkin's lymphoma. It is a rare disease and occurs in 3.2 per 100,000 men and 2.4 per 100,000 women, and this includes all races. It is most common in young adults between the ages of 15 and 34. It may also occur in adults over 55. As I said before, the diagnosis requires histologically distinct Reed-Sternberg cells, and the clinical symptoms are asymptomatic, and it has enlargement of lymph node, spleen, or liver. There can be also other symptoms such as fever, weight loss, fatigue, night sweats. Let's talk about stages of Hodgkin's lymphoma. At stage 1, cancer is in only one lymphoid region or in only one extranodal, which means outside of the node, region, or organ. At stage 2, cancer is in 2 or more lymphoid regions on same side of the diaphragm, or cancer is in only one extranodal region or organ and in surrounding lymph nodes. Other lymph node areas on the same side of the diaphragm may also be involved. At stage 3, cancer is in lymphoid tissues on both sides of the diaphragm and may have spread to an area or organ near lymphoid regions and/or to spleen. At stage 4, cancer has spread to an extranodal organ or organs on both sides of the diaphragm. Let's talk about the treatments for Hodgkin's lymphoma. The treatment for Hodgkin's lymphoma is radiation therapy and also chemotherapy, MOPP, which we call MOP, mecloteramine, nitrogen mustard, vincristine, oncovarin, procarbazine, and prednisone. Hodgkin's lymphoma often responds well to chemotherapy. 20% of the treatments are failures and may respond to various cocktails. Such cocktails are ABVD, which is doxorubicin, belomycin, vinblastine, and dacarbazine. The survival rate of Hodgkin's lymphoma is very high. When we look at the 5-year relative survival in the US by stage at diagnosis, within the years of 2003 and 2009, which includes all races and both sexes, within the local tumor, the survival rate was 90.2%. When the cancer has spread to regional lymph nodes, the 5-year survival rate was 91.4%, and when cancer has metastasized, the relative survival rate was 76.0%. When we look at the same data in the UK, which also includes all races and both sexes, between the years of 2005 and 2009, the relative survival rate for 5 years was 83.2%, 82.5% of men and 84% of women. So that's all for today. Thank you so much for joining us, and if you like our videos, please like them and share them with others. Until the next time, take care.